families, with a special attention really paid to how the pandemic has affected that and how we might come out the other end of it in a way that makes sense. So I can introduce myself. My name is Erica Huffman. I am the Youth Behavioral Health Director at North Central Healthcare. And what that means is I oversee a couple of different programs related to youth mental health. One is a youth behavioral health hospital, so a psychiatric hospital, and then the other is a youth crisis stabilization facility, which a mental health crisis by providing a short-term place for them to stay and receive some services and support. And Dr. Dakota Kaiser is the behavioral health consultant and clinical supervisor at Bridge Community Clinic, and he has a very large portion of this presentation. So if he is not here, that means he is likely stuck without power as well and unable to join. So we will do our best to adjust and get through for the day. But unfortunately, if he doesn't come, he an important stuff that he was planning to talk about. So if we see him join, we will pause and get him caught up. So nice to see you all. Thanks for coming. So we will talk about the mental health needs of kids and families and moving into the new normal, as I said. So I will share some information about the state of youth mental health kind of pre-pandemic. So before we tackled COVID-19 in 2020, Dakota then planned to add some information about discuss how to identify concerns in children and youth and what to do about those concerns. So hopefully we'll still have an opportunity to talk about some of those things. It would be awesome if we had questions and a little bit of a discussion. So please, if you have a question, it's a little hard for me while I'm sharing my screen to see people's video or hear audio, but I'll do my best to see a raised hand, or if anybody's monitoring the chat. Tara's plan was to monitor the chat and address questions.
Yep. Erica, we'll make sure if anything, so feel free to chat, you guys.
Yeah, that would be great. So anytime along the way, if there's a question, we can pause and address that. Otherwise, I'll definitely leave time at the end for some additional questions. And then after all of that, we'll talk about some resources that relate to meeting the mental health needs of children and families. So thinking about youth mental health pre-pandemic, so backing ourselves up a year and a half or so, we were concerning in some ways related to children and mental health status. So the CDC, this is obviously a resource that we've all become very familiar with, but believe it or not, they had jobs to do before COVID. And they told us pre-pandemic that depression and anxiety were on the rise in kids ages 6 to 17. That's one source of information. We also have high school students every year take a youth risk behavior survey that of teenage kind of health and wellness and patterns of behavior, and provide some really useful information in figuring out where kids are at and what they're struggling with. So 2019, pre-pandemic, almost half of students who responded to the youth risk behavior survey reported significant anxiety. So feeling anxious in a way that doesn't feel manageable or normal to them. 1 in 4, 25%, reported signs of depression. And of kids reported on this survey engaging in self-harm. So self-harm can be anything to hurt oneself, but often what we're seeing in teens is cutting, burning, pinching, scratching, picking at wounds, things like that. Those seem like high numbers to me anyways, that these are just average high school kids that are taking this survey, and these are the numbers that we were seeing pre-pandemic. There's a quote here from one respondent that said, "I'm depressed and I know other people who are as well. I feel as if it's teachers, counselors, because of the stigma surrounding mental health." And I think that it's useful to spend just a second referencing stigma because it's such an important topic when talking about mental health in general, adults or kids, but is, I think, especially worthwhile to recognize when talking about youth mental health. So stigma surrounding mental health exists for all ages. But if we were to think about kids specifically, it's easy to imagine wrong with them, or that they're weird is even more heightened. Kids place such a huge value on what peers think and their position in the food chain, kind of. There's so much energy that goes into projecting a certain image, and this can make it even harder for kids to ask for help when they're experiencing mental health difficulties. It's harder for them to be honest about their mental health and to put themselves in vulnerable positions where they're needing to trust others, all because of stigma. We hear from kids in our services barriers to know what's going on with them. They also say that they're bullied at school for being, different or odd or having some behaviors that other kids like to make a target out of them for. One boy who was in our hospital recently worked really hard to create a super tough image. It was important to him that people saw him as tough and kind of streetwise, and he didn't want to appear vulnerable in any way. He came to us from a juvenile detention center to appear strong. When talking to our therapist about a whole bunch of stuff, he started crying, and this really sent him into a tailspin. Did anyone see him cry? Any of the other kids that were in the hospital at the time? Was she going to tell anybody that he had this reaction? He shouldn't be crying. He shouldn't be doing this. This is what adults experience, but for kids, it can be even intensified. We also sometimes forget how it is to be young. Even before the global pandemic, life to have consisted of hours of homework, endless worry about grades, practices, band rehearsals, weekends filled with family obligations, family and friend stressors. There's a lot of things that are weighing on kids, and this all has an impact on their mental health. Just another quote from the Youth Risk Behavior Survey. Too many kids in this day and age go around feeling confused, anxious, and unsure about the things in their life and don't really get to express these things to talking to or trusting. Um, so we're hearing right from kids that they're struggling with these things. I would say also in my pieces that I'm talking about, I am often referencing teenagers, and there's a few reasons for that. There's a lot more research and literature out there about adolescent mental health than there is about like school age kids or younger kids. I live and breathe adolescent mental health every day, so it just tends to be what I'm surrounded by. It's certainly not hard to think about how these same things would affect younger kids as well. So I definitely don't want to leave them out. So then fast forward to the pandemic. So if this is the landscape of being a kid, especially a teenager, it's difficult. It's not easy. We saw what the Youth Risk Behavioral Survey tells us kids think and feel and experience, and it really does seem that COVID made it even harder. Um, so I'm as working with kids, being a parent of kids, whatever your world is, why has COVID made, in your perspective, being a kid, teen or younger, even harder? Would you be willing to type in your chat the reasons that the pandemic has kind of made life maybe contain a little bit more struggle than previously? So I'll just give you a minute. So type some things in the chat that you feel has had a negative impact on the mental health of kids. And I'll see if I can figure out how to see the chat. Yeah, I'm seeing all of the things that we see. Disconnection from peers. So kids who are used to hanging out with friends, or even kids who didn't have a super active social life or huge social appetite, are still not passing other kids in the hallway. They're still not having even those small kind of throughout the day type of connections. Lack of social coach, fear of missing out on things. So kind of that FOMO that is really big for kids. I just want to make sure I see all these because they're right on. Too much time at home. I mean, for some people, home is a great, safe, wonderful, nurturing place. I think we all can even identify as adults having to stay home all the time, how hard it was to not have our normal distractions or our normal releases. That's true for kids as well. Family stressors and tension, we'll talk, what's happening in the home is intensified because everybody's together all day, every day at times. Getting behind in school or athletics. So missing out on sports, and they missed a whole year of sports. And where does that put them for their life goals, their school goals, their career goals? And then how are kids' social emotional needs being met if they're away from school, other students, um, who are so important in meeting those needs? Looking at parental stress and fear from the media. So if we're hearing doom and gloom all day, and may or may not have like the cognitive ability or a really great context, that must be scary for kids. And then they're losing their usual coping skills. So things that maybe they would do to feel good, to feel healthy, are not always an option for them anymore. So much stuff that matters. And I think sometimes as adults, I know we had this discussion in my household, teenagers, and one of my kids, one of my sons, is like the most social person I've ever met in my life. Like, he is the epitome of a social butterfly. It's how he gets all his energy. He loves being around other people. And we were pretty strict with the pandemic. We did not do much. We didn't let them hang out with friends for a long period of time, and noticed the impact on his mental health. And he started getting more depressed and more isolated and more withdrawn. And we kind of had this argument deal. He has a supportive family. We're doing stuff every day. It's really not the end of the world. For kids, it can feel like the end of the world because this is how they define themselves, and it's so important, the peers and social connection. So thank you for those comments. Those are all of the things that have happened in the pandemic to make kind of the mental health of kids even more at risk. Not to mention, and maybe somebody did mention this and I missed it, but having such abrupt changes in it can be hard to come along with that. Younger kids have a really hard time understanding. I think of my 4-year-old nephew who just wanted to play with his with his neighbor kids, and it was hard to understand why that couldn't happen for a time. So just the ability to understand what's going on around them can make it real challenging. So then take all of that stuff, and here's the word bubble. It's like all of these things that are happening that impact kids and that matter. And add to that the whole growing and developing. The section of the brain responsible for critical thinking and impulse control and executive functioning is really not fully developed until 25. So kids, including adolescents, probably need additional support when it comes to regulation. And this includes sleeping patterns, use of their time, how they're using technology. So because of the pandemic, students lost the structure of school. And if it was coupled for some kids with the lack of students to navigate all of this on their own without really the brain capacity to do that well. And that led to, for many, odd sleeping patterns, overall dysregulation. This all can impact schoolwork, relationships, mental health. It's a lot. It feels like a lot. So that's the formula. There really is increased stress as a result of the pandemic, and this equals, and then it's multiplied or made worse by the reduced options for support that some of you mentioned. So if a teacher was somebody's biggest support, or a guidance counselor, or a daycare provider, or even grandma who they can't see anymore because she doesn't want to get sick, that impacts their mental health as well. So it also changed how kids could access support for their mental health. So many counselors went to virtual sessions. It's awesome to have that resource, and it's really great that their connection could continue even when people weren't meeting in person, but it's different. And that all has an impact on kids. I think we also have to recognize that these things are all at play, even in families that have resources, they have parenting skills, they're otherwise generally healthy and supported. But what happens when kids don't have structure and instead are wondering about how to meet their basic needs? So 45% of households in America, this was from December of 2020, experienced some loss of income due to COVID-19. Some families could weather that storm, others not so much. And then you throw in parental mental health. So just in talking with friends and coworkers, people talked about kind of feeling stir crazy, feeling irritable. By June, over a quarter had declined from the pandemic. That has an impact on kids' mental health as well. Sorry, sometimes I lose my cursor. Um, just some more information about the impact of the pandemic. I don't want to, I guess, bore you with a ton of statistics, but I do think that it's helpful to see some of these numbers because it kind of puts something black and white to something it all seemed like we've been feeling for the last year to say this is not happening. So in 2020, kind of height of the pandemic, a third of high school students are saying that they were unhappy and depressed much more than usual in the past month. 51% were saying they felt a lot more uncertainty about the future. 86% of parents reported changes in their children. That is a huge number. This could be, and these changes could really mean anything: difficulty concentrating, spending more time online in front of screens, less time being active physically. Um, Its claims for teens doubled for reasons like self harm, overdosing, a substance use disorder, anxiety, and depression. Um, this is These are all challenges that we have felt over the past year, but these numbers, this here, shows us that they were really happening, that this was real. So kids are saying things like, I was really sad I couldn't see my friends, or I prefer real school because I'm an energy boy. Homeschool, I just sit on the couch and say all things that are really hard for kids. One more slide about statistics, just to really highlight or outline how this has been over the past year. There was a report that studied 32 billion health insurance claims, um, and discovered that ER visits for child or adolescent mental health crises increased. Intentional, and so this is pretty local, for ages 13 through 18 increased more than 100%. And Wisconsin ranked among the top 5 states in the nation for the most intentional self-harm claims among ages 6 to 22, so young people. In reviewing this, it is, I think I've depressed myself. It's easy to feel horrible about the past year that we've experienced, but we also hear that there have been some good things that have come with the pandemic. So I'm curious if you have seen, either in your own lives or the people that you know, any silver linings from the pandemic, and if you'd be willing to enter that in your chat. Oh, that's such a good one, Kelly. Being forced to slow down, not like going from one thing to the other. There wasn't as much to do, so we all were forced to slow down. Grocery pickup. Yes, I feel like that is going to be around thing that has come out of this. And not just grocery pickup, but really everything pickup. You could get anything you wanted in a much more convenient way. More quality and intentional time with family. That was big. I joke that my kids were forced to hang out with me during the time that we were all staying at home, and it was wonderful. That part was wonderful. My kids know how to wash their hands really well. So yeah, we've learned something, right, about how to stay healthy and pretty good in that, and tons of family time. People were together more, and that was positive. Definitely an appreciation for teachers. That's a really good one. Parents got to see firsthand how hard it is to make sure that their kids are learning and absorbing information and staying busy and engaged and doing all of those things. Yeah, that's an awesome one. Now that we're coming out of it, it does feel a lot more frenzied in some ways. You know, kids have activities are happening. There's no time to eat dinner together, those types of things. Yeah, those are great examples of there is some silver lining here. It's not all horrible and doom and gloom. Thank you for that. So this piece, and I should check just in case he by some chance joined, Dr. Kaiser.
Erica, can you hear me?
You're here.
Yes, hello. Sorry, I candlelight in my office here, so I apologize for not being able to join you by video.
Well, we're glad you're here at all. So I will let you, as long as you are able to navigate by candlelight, take it from here.
Awesome. You guys can hear me okay? I'll take no sound as a good thing.
Yes,
so,
Dr. Kaiser, we can hear you. Wonderful. Thank you very much for being here. We can hear you.
Fantastic. Awesome. So I'm going to try to do this blind. But kind of the truncated message I want to bring to you tonight is what to look for in the kids in your life. So the first thing I wanted to address is the difference between mental health and mental illness. They're terms we use very similarly and often interchangeably, but they are different. So when we think about mental illness, these are our conditions of thinking, feeling, mood, and behavior that is what happens when things go wrong. Things like schizophrenia, personality disorders, kind of a list of all sorts of challenges that a lot of our kids are facing. That's different than mental health. Mental health is kind of more, is a broader term talking about how we deal with our emotional, psychological, and social well-being. Now, you can have good mental health, where you can handle stress okay and still suffer from a mental illness. And you can have poor mental health, where it's hard to handle stress and hard to relate to others, and not be diagnosed with a mental illness. So what I'll try to talk about tonight is a little bit of what to look for with poor mental health, and then when those things do turn into mental illnesses. We can go to the next slide. Erica was apologizing for all the statistics. My doctoral minor was in quantitative psychology and statistics, so I will not apologize for more statistics. But in our kids, and in 2018, again, before the pandemic, 50% of all Americans will at some point during their life. On any given year, about 1 in 5 Americans will experience a mental illness. 1 in 5 children will experience a seriously debilitating mental illness before they reach the age of 18. And 1 in 25 Americans live with a serious mental illness, like bipolar, severe PTSD, or schizophrenia thought disorder. So this is kind of a common experience in life with our kids and adults. Next slide. Things that our youth are most likely dealing with when it comes to mental illnesses. We have some charts here from this past year, but these are a little bit older, about what the most common mental health problems are and when they tend to develop through the lifespan. So in our kids, the most common is ADHD, problems with attention and concentration and hyperactive behavior. Almost 10%, or 6.1 million ADHD, incredibly common. Now, this one doesn't play by quite the same rules, in that ADHD is a neurodevelopmental disorder. This is kind of one of these disorders that's primarily genetic. And we tend to see develop as kids age, starting, somewhere in kind of the late toddler years into the school years. But it really has to do with how the brain develops more so than a reaction to any stress or stressors in the environment. Like having trouble following rules, acting out aggressively, a variety of different concerns here. Again, 7.4% of kids deal with this cluster of disorders. And then the ones we're most familiar with, anxiety and depression. About 7% of kids deal with a diagnosable case of anxiety, and about 3% deal with diagnosable depression. What we tend to see is that anxiety tends to have a little bit earlier presentation. We can see this to 11-year-olds in elementary school, where things like depression tend to happen more in the teenage years. Behavioral disorders, again, a little bit earlier, happening, kind of seeing an earlier curve as early as the late toddler years. When we tend to dig these numbers, we see there's a high degree of comorbidity. That means that if you suffer from one, there's a higher chance you're going to suffer from another. Kids with anxiety often have depression. Kids with ADHD often have anxiety. These things often come in one particular problem. And the thing I want to bring attention to is that while we know that these kids are suffering and dealing with this, they're not all getting treatment. If we look at ever go on to receive treatment, the number about 6 out of 10 kids receiving professional treatment after being diagnosed with anxiety.
Dr.
And behavior
Kaiser,
problems.
Dr.
Yeah.
Kaiser, I'm going to interrupt for just a second. Last 3 sentences that you said, you're
Sure,
cutting in and out just a little bit.
No.
Yep, a little bit. So I think it's just probably when the thunder hits. So if you can repeat the last 3 sentences and then go on.
Certainly. So I was just talking about how there's a real gap between diagnosis and treatment. So we can suspect that kids are underdiagnosed, that there are kids out there who are dealing with these issues who never get in front of a professional to make the diagnosis. The number at treatment, we see that about 8 out of 10 kids who are diagnosed with depression receive treatment. That leaves 20% of kids diagnosed with depression not receiving care after the diagnosis. The numbers get worse for anxiety, with only about 60% of kids receiving treatment after diagnosis, and only about half of kids diagnosed with behavior going on to receive treatment. Next slide, please. Other common myths, just to kind of name out a few, and I won't linger here too long so we can get onto some questions. But sleep disorders, incredibly common. Kids not being able to fall asleep or waking up and not being able to get back to sleep. Incredibly common in both adults and children, and often goes untreated. Eating disorders, often associated with anxiety. Kids who aren't eating enough or are kind of exercising some amount of control by restricting their eating to their anxiety. PTSD, having problems after experiencing trauma, incredibly common. And then things that are more common, like an adjustment disorder, which basically just means kids having a hard time adjusting to a difficult situation, going through something in life, family trouble at home, difficulties at school, and really experiencing true distress and dysfunction related to.
Dr.
Next slide.
Kaiser, we have a question in the chat. What is the barrier to getting treatment?
The barrier, I think they should be barriers. There's so many, and Eric, I'd love to get your take too, but the first thing that comes to mind is stigma and knowledge. Feeling like there's something to be embarrassed about, or that they can't share what they're going through. And if they don't express a problem, it's hard to get connected. A lot of people don't know that we're doing this tonight. Know that parents know that their child have a tough time, but they write it off to say, oh, it's just the teenage years. Oh, it's middle school is tough, without really truly understanding the underlying problems. And another major barrier that I'm passionate about is it's really hard to get connected with care. There's too few providers, wait lists are long, it's tricky to understand how to navigate the system. It's hard to know the difference in a counselor, and the systems of care are incredibly complex, and hard to navigate. Eric, I'm curious to hear what you've noticed as barriers.
Yeah, the last one that you said is huge. Accessing care is definitely a barrier, not only because it's complex to navigate in the ways that you say, but also because care isn't accessible to everybody with every insurance, with every financial situation, parents who would love to get some additional ongoing specific treatment for kids who are discharging from our hospital, for example. But that care often comes at a really hefty price tag. And they, as a family, are stuck figuring out, boy, do we go into debt so that we can get our kid the intensive treatment they need? Or do we do our best with what we can more easily and more affordably access? So that financial barrier is real, in addition to the access barrier with many kids with challenges.
Totally, and even outpatient care is really expensive. If you think about going to a counseling session once a week with a high deductible plan, that will add up incredibly quickly and can be really burdensome. Great question. Are there others while we're paused? Or should I roll on?
Nope, it
I'll
looks like
roll
you're
on.
good. Yep, keep going and then keep going. If anybody has any questions, feel free to put them in the.
So when I was taking some time to think about what would I want families to be on the look for, my intro psych class from freshman year popped into mind about what defines a problem. We talked about the 4 Ds: deviance, distress, dysfunction, and danger. And I think we can use this as a guideline for trying to understand, is what I'm noticing in my child or a child I care about something that needs more attention. So the first is deviance. Does this stray from the norm of care? When you look at other kids in their class, their peers, older siblings, this is a little bit different than what you're seeing as standard behavior or things other parents are talking about. Next is distress. Emotional trouble. Is it hard for them to deal with? Is it causing distress in any way? Next is dysfunction. Does it make it hard for them to navigate their world? Are you seeing problems in school? Difficulty getting along with peers? Having a hard time kind of navigating all the challenges of childhood and adolescence. And then the last is danger. Is this dangerous to them, or potentially dangerous, to their success? I mean, into these critical years where they need to be learning and developing all these sorts of skills. So I listed a whole bunch of different things to look for here on this slide. Some things to pay attention for: their baseline. If you have a really outgoing child who has been social and suddenly and noticeably becomes more withdrawn, that's something to be paying attention to. Again, is there a noticeable difference between the child and their same age peers? Other things like persistent sadness, avoiding social interactions, changes in sleep and appetite, frequent stomach aches and headaches, something the parents often physical signs of anxiety and distress to show up. Difficulty concentrating, low motivation, extreme mood swings, all kind of some of these signs that say maybe it's time for us to talk to someone. Now, again, it's important to remember it's a stray from baseline. It's a change. Some kids aren't that social, and that's okay. Some kids are a little moodier. That's okay. But when we're seeing extremes, when we're seeing these things being atypical for that child or compare peers, that's when it's time to pause and at least have a conversation with the child and likely kind of seek a professional opinion. Eric, I think at this point, I'll kick it back over to you to talk about how to get folks connected for resources.
Absolutely. Let me just forward it one more. Um, so some resources that probably many of you are well aware of, but worth mentioning, the amazing resource for providing information and support around mental health. So I just shared one example here. This does not mean that there's not other school districts doing an awesome job with this, but this is just an example from the DC Everest School District that they provide to parents information about emotional health resources and activities, mental health resources that they can access. So this is one way that schools are serving as a really great mental health resource, is by being that kind of central place for parents to get information for child. Schools have also been doing mental health screening and increased mental health screening. I was super impressed. Recently, we had a kid admitted to our hospital, and part of the reason that there was a seeking out of services was because the guidance counselor recognized there was a change in behavior. So like Dakota was saying, a change from baseline with a child that she worked with, and started screening that kid every day for depression and reporting those screening results to their community therapist. And extra intervention. So schools are a great resource in that way as well. Schools are also able to do social emotional learning and programming with kids. And then we're seeing more and more schools and behavioral health care agencies working together. So here in our community, we have counselors in schools because of a partnership between schools and behavioral health agencies. Schools also provide health and wellness education and mental health awareness programs and stigma busting, like all of them, support and information to our kids when they need it. Another resource, and I'm starting with these two because everybody, just about everybody, has access to school as a resource. Just about everybody has access to a medical provider. A pediatrician or a primary care provider can be a great resource. I think that good advice for parents who don't know where to turn or where to begin is a primary care provider. So if family bad starting point. They're able to do some screening, look at some social emotional health needs of kids, kind of explore some other concerns, and make recommendations and referrals for more specialized care when that is needed. So medical providers are always a great resource, and truly not everybody is connected to a primary care physician, but most people have access to somebody who can start getting them pointed in the right direction. I think it would be a coordinated event, but to not recognize the great resources that the United Way has available related to mental health as well. So 211 is a great place for parents to start. The Give and Get Help Guide. There's a Choosing a Counselor booklet that helps people understand who in our community is seeing kids and how might they access them. So another great resource. I also want to share North Central Healthcare has several resources that serve and their families. So there's emergency or crisis services that are available 24/7. There's outpatient services, counseling, and psychiatry. There's a psychiatric hospital. And then there's also case management services or service coordination through community treatment. Internet, of course, is everybody's best friend. You can find all sorts of stuff when you Google it, but some good resources to note if people, so caregiver people who care about kids, are looking for information, here are some decent places to start. The Wisconsin Office of Children's Mental Health has kind of a nice catalog of information. They come up with a monthly kind of, I think they call it a fact sheet, but sometimes it's an infographic about kids' mental health. The World Health Organization, the National Institute of Mental Health, the CDC, UNICEF, they have all paid a lot of attention to mental health in general, but especially to teen mental health and specifically how that's affecting kids. So those are great resources as well. Dakota, is there things that you would add about Bridge Clinic or other resources that you turn to regularly?
Sure, I can talk just a little bit about our clinic. So Bridge Community Health Clinic is an FQHC, qualified health clinic, which means that we are offering primary care, dental, regardless of finances. We take all forms of public and private insurance and have some kind of unique funding mechanisms to try to make care accessible to those in our community who may not be able to afford it otherwise. We have outpatient counseling and psychotherapy, as well as medication management. You have on-site interpreters for both Hmong and speakers. And to note that we actually recently hired a bilingual Hmong and English listener to be able to serve that portion of the community in a way. The thing I would add is, if you're not sure what, just turn somewhere. Everyone I work with in town is really eager to try to get you to the right spot. Feel free to call our social worker who is happy to make phone calls and find a place that can get you in quickly that meets your needs. And I know most other clinics and resources in town have the same.
I would also add that we have a pretty rich network of resources. So private counseling agencies, places that specialize in seeing kids and families. And so I agree with Dr. Kaiser. There's never a wrong door to getting a child mental health help, that if you start somewhere, you're likely to end up somewhere helpful. I'm going to stop sharing now and see if there are other questions that we could answer. What other questions?
On behalf of United Way, I would just want to thank everybody who was able to be here today. We are getting reports in right now from our staff, and the little storm that went through was significant, and most of our staff does not have power. There are trees down, there are shingles down, there's a trampoline that got moved. So thank you for everybody who was here. Done with this presentation, go check your backyards, because apparently that little storm turned into just a little bit of damage for a number of people on our staff, and we are getting those reports in right now. So thank you for everybody who was here. We will stay on for a couple of minutes. This is an open session. If anybody would like to speak to the professionals, ask any questions, if you want to put it in the chat, remain anonymous, or if you would like to come off mute and turn your camera on, this is a session for you.
Erica, while we're waiting,
we have a number of thank yous coming in, Dr. Kaiser. So thank you very much. Feel free to go ahead and talk.
Awesome. Yeah, I had a question for Erica that I often get, but could you share what parents could expect when they call crisis or would need your services, and what that process looks like that might ease their mind should they ever need it?
Yeah, that's a great question. So in order to access emergency services, so if kids are experiencing a mental health crisis and need, the place to start is with the Crisis Center of North Central Healthcare. And the Crisis Center has crisis professionals that are working around the clock to take phone calls, walk-ins, calls from schools, sometimes calls from law enforcement. Kids and people in need can access Crisis Center in all sorts of different ways. If somebody comes to the attention of Crisis Center, generally what happens next is a crisis assessment. So meaning that crisis professional talks with them and get information that will help them make a decision or a recommendation about what is the best and safest care that can be provided to that child or youth in that moment. And sometimes that means a hospitalization. Sometimes it means return home with a safety plan. Sometimes it means just connecting them with outpatient services the next day, the next week, the next month. It can mean all sorts of different things, but the Crisis Center's job is to gather a bunch of information and figure out so what parents can expect is really to be included in that conversation. So a crisis professional would talk to oftentimes the youth individually and then the parent as well to gather additional information, and then as much as is possible, depending on the emergency, include both in decision making about what happens next. Doesn't mean I do hear sometimes a couple of things that they're worried that it means somebody might swoop in and take their kid and you know bring them in a squad car to a hospital. That is not how it looks. Of course, if there's imminent danger or a huge risk that can't be ignored, swift action needs to happen. But ideally, the process is one that includes parents and the youth to get to some safe outcome.
Thanks, Erica. That's really helpful. I just hear from families all the time that there's always an awesome resource in our community that folks can call, even with questions if they're not sure they should be calling. Those crisis professionals are just fantastic at helping folks make decisions and getting them to the right spot.
I also hear from parents a lot about they'll come into our hospital, so our psychiatric hospital, and say, this is nothing like I expected it to be. So they have this picture in their head about something institutional or that feels kind of cold or unwelcoming. And our goal is to make it not like that. And so we hear those comments often from parents and from kids. And so I think what parents can expect from services might be different than the picture that's in their head.
Does anybody else want to come off mute and ask a question? Helpful, both of you. Thank you very much. Thank you for weathering the storm, Dr. Dakota. We really appreciate it. There is a question in the chat. We will ask this to both of you. Is there a difference between stabilization and the crisis bed?
Yeah, that's a really, really great question. And the answer is yes. And I can talk for just a second about what that means. So North Central Healthcare for probably a decade or more has a youth crisis bed or a youth crisis stabilization bed for kids who need really short-term crisis stabilization, maybe just to get them through the next few hours, up to 24 hours, outside of their home setting with a supported trained mental health professional. And that's been provided here at North Central Healthcare for a long time. We now are working on implementing a more comprehensive youth crisis stabilization program. And that program is not open yet, but we're hoping within that will be an 8-bed youth crisis stabilization program that will include a full treatment schedule. So groups and individual therapy and group therapy, care coordination, things like that. And so once that program opens, so the 8-bed youth crisis stabilization serving kids of any age, what was previously called the youth crisis bed as part of North Central Healthcare, it will no longer be available. And all kids who need some stabilization services, they're not quite safe to go home, but don't quite need the hospital, will have the option of utilizing the 8-bed youth crisis stabilization program.